You ready? Here we go. Yes, we're talking hockey. Finally. Okay, I'm not proud of talking about hockey injuries, but it's Barkov. Wait a minute. Oilers might win. Panthers may lose. Cut it out, cut it out. No, I'm not excited about Barkov injury, but yeah, Barkov's out. ACL, MCL, non-contact during practice. That video showed it all. He was being helped off the ice, right knee. Charles has a right knee. And what happened? So, Charles, he went down and, okay, you gotta stay with me. On the video, you see that he's coming down, he does a little jig, like I'm trying to hold his hockey stick, right? He's like moving around just like me, so fast and slick, right? And then he just suddenly goes, whoop, and he goes down, right? And then he gets up and he has to limp off, right knee injury, ACL, MCL. He is out for the season, which means Oilers have a chance. Leafs have a chance. Everyone has a chance to win. So all of a sudden, I mean, you've read all the reports. You've been watching Center Ice. You know on all the ESPN channels, and everyone's talking about it, who's number one. Well, guess what? The Panthers just dropped. Oh, right. Okay, we're going to talk about his injury. All right. Can you edit out my excitement? All right, so ACL, I've got plenty of videos on the ACL. He had a non-contact pivot shift, and it was really interesting. Like, you can just barely see a little bit of that sort of shift happening on the video. But, you know, essentially, he's going to have surgery. He's going to have the reconstruction, autograft, allograft. We've talked about all the different options. The MCL, is it repair? Is it reconstructed? Usually, when you have isolated injuries, deal with the ACL. If you have an isolated grade 2, or sometimes maybe not a grade 1, but isolated grade 2, you don't always have to do surgery. But if you have the ACL and the MCL, then you might as well, since you're there, fix them both. And you're going to do the ACL anyway. And the healing, you might as well get the MCL stabilized at the same time. And surgical options, regenerative options, rehabilitation options, lots of things to consider. However, when's he going to come back? He's not coming back this season. Will he come back for the playoffs? I don't have a crystal ball. Do you, Charles? Oh, right. Oh, by the way, Charles wanted me to introduce you to Philippe. Yeah. Philippe is our one-eyed llama. We're just helping him along. Yeah, it is a little freaky.
No legs, one eye.
Yeah.
He's got problems.
Yeah. So anyway, so what's the minimum time for the ACL? Isolated ACL, 6 to 9 months, sometimes 12. You're talking about ACL, MCL, it's cutting it close. October 7th, let's count it out. November, December, January, February, March, April. That's 6 months, right? May, June. So I think it's going to be tough. I mean, the rehabilitation, proprioception, balance, kinematics, we've talked about it all. You know, seeing all of that happen, he's going to be out for the season. That's a big injury. And wishing you the best, Barkov. I actually am, sadly disappointed that you had this injury. It's kind of unfortunate. Because when you get the top player out, yeah, sure, it might be great for all of, the non-Florida Panthers fans, but then we don't get that level of play. Beating Florida at their best, would have been awesome. All right, so let me just go over what's happening. I mean, this is the knee that I've ripped apart many times, you've seen. So we remove the patellar tendon. And so essentially what happens, I mean, this is a right knee. So when he went down, he kind of did this, and he, okay? So this pivot shift, bone on bone, usually it's lateral meniscus for acute, and then you get the strain on the MCL, so that's the coronal, in the coronal plane. The rotational kinematics of the ACL is in multiple planes. Now, you could have the knee in a bit of flexion, little bit of varus, and then you get this happening, right? And that's the injury to the ACL. Now, obviously, you know, the meniscus doesn't just pop out like that, but it can, okay? But that's in a testing scenario. And don't laugh, don't laugh. So just this video gimmicks. So the MCL is on the inside medial collateral ligament. There's also a lateral collateral ligament, and then you have the ACL, which is the big one in the front, and different mechanisms of tearing. We've talked about it before. Quick repeat. You can have it mid-substance, you can have it at the origin from the femur, or you can have it ripping off, like as in this case, from the tibial insertion side. Now, obviously this isn't a perfectly anatomic model. Have I said before we need better models? Yes, we do. And so the main thing is that he's got 2 major ligaments torn. So one thing I know you guys are asking about is, was it the skate? Maybe someone in the equipment room is going to get fired for not sharpening his skate well enough. Maybe. Could it be the skate? Maybe. But, you know, honestly, like, these players, they've been on the ice so often, you know, the skate is like a shoe to them. Now, yeah, it's more pounds per square inch on a blade, but these are newer blades. They actually are much sharper, they last longer, and they're more durable. So, you know, you don't have those crazy injuries and the skate flipping off like sometimes it can happen, and has happened even recently in different games and scenarios. There is a lot of pounds per square inch, so you're talking about a blade, a platform, like instead of, you know, him standing like this, you've got him sitting on a blade like this. So even the forces, could the forces be higher? Maybe. Like if he loses his edge, maybe. Maybe he's just off balance, you know, it's early preseason training. It happens. But we don't really know the answer to that because we don't have the in vivo kinematics that we, you know, could have when you're actually looking at the knee while it's playing. And, you know, and that's what we're doing with Kinesi. We would capture the live real world data, the real world kinematics while they're skating to know what actually is happening. But right now we just have a camera from a distance during practice, and then you don't have a gait lab. So you don't really know the full detail of the force kinematics going on there relative to that blade. What was the blade angle? What was the foot position? All of those things. What were the forces within the knee? We talked about it before. You know, a lot of what we know is just based on the lab biomechanics, the indirect perspective of the kinematics of the knee. Because you're not going to have someone go and, you know, hey, Barkov, let's just rupture your ACL and then you play. So obviously it didn't happen like that. Obviously you can't do that. But yeah, there's so much more information that we could know that we don't know. And this is even affecting, you know, what the surgical decision making and surgical outcomes are. So one of the questions you might be thinking of is MCL, ACL healing. You know, one of the challenges, again, depending, we don't know all of this. This is an educational video. We're not talking about the specific medical advice relating to this injury. We're using that injury in context for what we're talking about. But when you put the MCL and the ACL together, one of the things about the MCL is that if you have an isolated MCL, and those of you who've had one, you limit the flexion of the knee, the bending of the knee when you repair or reconstruct it. Now, more than likely, that's another reason why you would, repairing the MCL at the time of the ACL is valuable, because then you can push the limits of the range of motion, because you don't want to slow down the rehab for an ACL. Now, The other thing we haven't talked about and no one's talked about is we don't know if there's going to be a meniscus tear. Like we know, no one's talked about it, no one's mentioned it, but there are times where you may not have a meniscus tear on the MRI, and it turns out at the time of surgery, by the time you get there, you have a meniscus tear that was unappreciated, under-recognized, or not visualized on the MRI. Remember, the MRI is a 2.6 to 5 millimeter slices of your knee in 3 planes that identify the tissue based on magnetic resonance and deflection of water. So it's an indirect visualization of the knee and all the ligaments and tissues. So if there's a meniscus, maybe the slice missed it. You know, typically you would see it and you would expect for acute tears a lateral meniscus and chronic tears a medial meniscus, but sometimes you can have both. I mean, I'm not saying that he's not going to have or will have a meniscus tear. A lot can be identified at the time of surgery. And so we'll learn more. When it comes down to it, having the ACL and the MCL, the MCL will definitely heal faster than the ACL. There's a lot more kinematic stability required with the ACL. And doing the repair of the MCL, as I mentioned before, the advantage is that you can then push the knee range of motion. You don't have to try and protect it within 30 to 60 degrees like you would with an isolated, non-surgical MCL.